As our case is heard before the District Court in the Eastern District of Washington today, I wanted to share my thoughts about the moment we're in. Because with so much ahead of us, NFPRHA members and the millions of people who rely on and trust our health centers should know very clearly where this national association stands. The new Title X regulation is the most consequential shift in the Title X program in its history. If implemented, the long-standing network would splinter, and all the effort that has gone into providing services that meet the patient where they live would be lost. When I say where they live, I mean geographically, because 90% of women in need of publicly funded contraceptive care live in a county where a Title X health center is located. But I also mean where they live, connected to their needs and values, serving patients in a way that is effective for them. I don't claim that every employee, every day, with every patient is able to achieve that goal. But I do claim that as our goal, that every person seeking family planning and sexual health care should be met with dignity and respect. We should not shame them or blame them for their experiences or concerns, but instead partner with them so patients can be confident and healthy. This new rule wasn't written to show respect for patients. It wasn't crafted taking into account the advice of Title X administrators or the expertise of clinical professionals. It was written for organizations and individuals who want to limit these services and slant the information that women, men, and adolescents receive when they seek care. This rule is written for their benefit and with their interests in mind. On behalf of thousands of highly qualified people, executive administrators, program directors, clinicians, educators and outreach coordinators, quality managers, finance and front desk staff, and for the good of the people who need care, we sued the administration to stop this rule. NFPRHA is a national association founded the year after Title X was enacted. Today, we're a coalition of more than 850 organizations that provide family planning and sexual health care nationwide. NFPRHA members don't share our name or a brand identity. Our buildings do not look the same, and there's no Title X sign on the front door. But whether a patient walks into Cedar River Clinics in Tacoma, Washington, or Womenkind in Key West, Florida, Access Esperanza in Mission, Texas, or Maine Family Planning in Bangor, she can tell it's a Title X health center by the way she is treated. From the way a person is received at the front desk, to the counseling and education that they receive, to the full range of contraceptive methods available, including the newest and most effective contraceptives, Title X health centers lead the way. We lead the way because we share a commitment to care for the poor and low income, a commitment written into the Title X statute in 1970. Title X was intended to equalize access to modern contraception, and it continues to deliver on that promise today. But it also represents the gold standard for how we want family planning and sexual health care in this country to be delivered. Title X leads the way because we're required and proud to be held to the National Quality Family Planning Standards introduced in 2014 by the Centers for Disease Control and the Office of Population Affairs, standards that are still in place for Title X health centers across the country. So we sued. We sued in disbelief that the nation's family planning program may come to allow the rhythm method and abstinence unless married education to become an acceptable service mix. We sued in alarm that clinicians' confidential discussions with adolescent patients would be overseen by HHS, and that adolescent medical records may be read by HHS employees. and we sued in outrage that organizations which offer limited information and services that do not meet the national standards, that are not healthcare, may become a patient's only choice. We can't allow this administration to annihilate this successful, proven public health necessity. Women, men, and adolescents need access to confidential, high-quality care no matter where they live. And one of the most important elements of Title X is that you can find a Title X provider, whether it's a local health department or a private not-for-profit, in nearly every county in this country. Especially today, I want to speak directly to those providers, NFPRHA's members. Title X is the gold standard because of you. When patients find you, when they find a health center in the provider network you built and sustain, people get the time-sensitive access to life-saving care they need and deserve from health center staff who meet them where they live. To protect your work, we sued. Today, a judge will consider our case based on the law. But let me put it in non-lawyer terms. Our lawsuit tells your story. It defines the need for Title X and defends the evidence-based approach currently in place. It makes clear that there are no better people working in family planning today. Our members are not, as HHS claims in the rule, less qualified to receive Title X funds than organizations that want to limit services and slant information. No one is better qualified than you. You keep up with the research, you understand the best practices, you innovate, and then share your lessons learned. And collectively, you craft extraordinary levels of service. And you do this while centering the poor, the low income, and the vulnerable in our society. To support you, we sued. And just as you keep your commitment to confidential, high-quality care and continue to do your good work, NFPRHA makes a commitment to you. We will work as hard to keep Title X strong as we do to save Title X. Your national association will stand by you, and we will take this fight all the way to the end.